Hi, March is endometriosis month and it's also endometriosis week this week, hence where we're actually going to do this video about endometriosis. Quite a long word to say, and it's one that gynecologists often diagnose, but they don't always give any treatment and they don't always know what can help it. Acupuncture can help with endometriosis. It can help with all of the symptoms and help to manage it. And a lot of the times we're told, get pregnant and then it'll get better. And it does. But it doesn't get rid of the problem. And I see women in their 50s and 60s still having problems with endometriosis and they're not having periods. I've actually seen an 80-year-old with endometriosis problems because they're getting migraines from it because the lining has shed. But number one, if you're having endometriosis, you know you have it, go and get some acupuncture. It can really help. Number two, how do you know if you've got endometriosis? So I thought I'd tell you some of the symptoms. Now, the biggest thing we always know is it's going to cause pain. And a lot of people expect the pain to be in their period. It can be just before their period. It can be in between their periods. It can be just after their periods. It depends whereabouts the uterine lining has gone and at what stage in the cycle it's bleeding. So it's not necessarily painful periods. And because of that, people go, well, it's not that. But I do get pain, really bad pain just before, or really bad pain just after, or really random, really bad abdominal pain in between. I think I got a bit of IBS. It might not be IBS. It might be endometriosis, ladies. So you can also get general chronic pelvic pain. You do tend to have more heavier periods, but again, not with everybody. So that one's a red flag. You tend to get painful bowel movements, especially if it's on that part of the intestine. Pain after intercourse, sometimes painful urination as well, not stinging, just painful. You can also have ovulation pain, rectal pain, abdominal bloating, lower back pain, headaches, knee pain. They can all be an indication of endometriosis, which is mad. And of course, we can get nausea, weakness, fatigue, and insomnia. These are all symptoms of endometriosis, but not stuff that you hear of. So if you're having cyclical, meaning same time of the month pain, in weird places, mostly abdominal, but it's cyclical, it might be worth going and seeing your gynecologist or speaking to a GP to get that going. And if all else fails, go see your local acupuncturist and get some acupuncture. This has been Thoughts with Points. Take care.